We're going to be going on to our keynote now. And so I just wanted to go ahead and introduce Dr. Mindy Fullilove, who's an urban psychiatrist and professor of urban policy and health at the New School. She is a board-certified psychiatrist, having received her training at the New York Hospital Westchester Division and Montefiore Hospital. She began her research career in 1986, examining the U.S. AIDS epidemic and its relationship to place and residence. She has studied epidemics of poor communities and examined the mental health effects of such environmental processes as violence, rebuilding, segregation, urban renewal, and mismanaged toxins. Much of her research focuses on the relationship between the collapse of communities and the resulting decline in health. From her research, she has published over 100 articles, as well as 6 books focusing on the health problems caused by inequality and what we can do to advocate for change. So with that, we would like to go ahead and welcome Dr. Fullilove onto stage.
Hi, everybody.
Hi.
This is in my career, and come May, I graduated from medical school 40 years ago. So this is in my career really a signal day. The actual being in a medical school, talking about gentrification with a whole group of doctors, medical students, community leaders, activists, is a fantastic thing, because breaking out of the limits of the biomedical model that we've all been trained in is a tough thing. So that you're thinking enough outside the walls of the medical school, I just really want to compliment you. Back in the day when I was in medical school, we were thinking outside the box, but there were about 4 of us, and you have hundreds. Norman Rockwell's Doctor, listening to The Heart of the Doll is, I think, a really good place to start, because this old country doctor knew that the doll was important. And the doll is not the child. So why do you have to listen to the doll? And gentrification is really about how do we understand that listening to the world in which the person lives is listening to the person. They're inseparable. How do we get there? And I thought it would be, I just wanted to share that how I got there was because I adored my pediatrician. And so this is my pediatrician at the microphone. And not exactly the Norman Rockwell, right? Sitting at the doctor's desk with the stethoscope, although I certainly was in his office enough as a child. One of the things in my childhood, they invented the polio vaccine. And then every year they kept deciding you needed more vaccine. So you had to go get more, it was just awful. You had to go get more polio vaccinations. But on the other hand, we didn't have polio, so that was a great thing. Anyway, that guy gave me all those shots. But here he's really in that role that Norman Rockwell is suggesting to us, which is understanding the bigger picture of the world, of the children that he was caring for. And he's speaking as president of the Board of Education of Orange, New Jersey. And he's at a city council meeting, and he's fighting for the city to approve a bond issue to build a new high school. This is a fight that went on for some years, which was successful, and he was the leader of it. So I wanted to be a pediatrician, and I wanted to be like Dr. John Alexander. I got to know the story in great detail because I helped my father, Ernest Thompson, write his book, Homeboy Came to Orange, A Story of People's Power, which was about his work organizing for black political representation and then to build citywide coalitions for justice in Orange, New Jersey. And Dr. Alexander was a foremost actor in this process, and he and my dad were partners for quite a few years. The issue of thinking outside the box is, why is this important? And one of the stories that comes to mind for me is a story of scurvy. Before I went to medical school, I did a year at the Institute of Human Nutrition at Columbia University and got a master's in nutrition. And one of the things that they did was really take us from molecules to society. So vitamin C, all the vitamins, right? They're acting at the molecular level in important ways to keep our metabolism going. But the discoveries, like the discovery that lemons and limes could prevent scurvy in the British seamen, don't get implemented right away. So they figure out, Lind figures out, that you can use lemons and limes to prevent scurvy in 1753. But it's almost 50 years later before the British Navy implements it. So thousands of men died in that 50-year period. If we think of all the things we know that are helpful for people and how many decades we've spent not doing them, how many lives were lost, this is what really says, wait, we've got to step outside the box, because medicine isn't just about what I know as a doctor. It's about what the society is willing to do. But when you go to medical school, which I did next, that's my medical school, now the Roy C. Vagelos Medical School, you know, that you went in that box and you didn't come out. Well, it's a pretty scary thing. You know, it was a constant thing on your head, right? Trying to socialize you into medicine. This was 40 years ago. Things are a little hipper now. For example, there are quite a few women in this room. And there are quite a few people of color in this room. And there are quite a few beautiful people in this room. So times have changed. When I was in residency in psychiatry, there was a paper that was published in 1980, so middle of my residency, by George Engel on the biopsychosocial model. And the paper describes a man who has a heart attack. And so Engel's point was that the biomedical model was not enough to help us understand what happened to this guy who had this heart attack. The heart attack is going on inside of him. So Engel has, if you can see the model, the sort of box in the center is at the person level, and then it goes down to the molecular level. Many things are happening inside the person. But if you notice, the model also goes up out into the world, to person, to the family, and to the community. And Engel's point in this paper is that you can't just go down the hierarchy of systems, you have to go up the hierarchy of systems as well. Because the first thing the man does at the level of the two-person system is he disengages. He's having pain, he's hoping it's not a heart attack, he's had a heart attack before. He doesn't say, call for an ambulance. He says, well, I better clean up my work because I don't want to impose on anybody. So he's in denial, right? And he's not asking for help. He's retreating into himself with his fear and his pain. This is fundamentally important. And Engel then goes on to say, finally, his employer, he says to his employer what his experience is, and she says, you got to go to the hospital. And really, don't worry about the job. Don't worry about anything else. Take care of yourself. And so she helps him get the care he needs. And if you look at the two-person level, there's communication and engagement, and he accepts help. But notice also the things that are happening at the other levels. At the family level, there's strain, concern, altered role, tasks, and realignments. And at the community level, there's a mobilization of medical resources. A lot of things are happening at a lot of levels that are not simply what's going on in the man's heart muscle. And this becomes very important as events unfold. He's been into the ICU, and they try to create an arterial line, and the residents aren't able to do this. They walk away to get help, and the guy goes into ventricular fibrillation and flatlines. They're able to resuscitate him. The rest of his recovery is uneventful. He goes home. But Engel says, let's pause at this for a second. Because what happened to the guy when they tried to do this arterial puncture and they couldn't? This is a guy who, he doesn't say, wow, I'm really scared. He's not going to talk, right? We already know he disengages. And he keeps the stress and tension to himself. And it's the stress and tension that irritate the heart muscle Engel hypothesizes and sends him into VFib. So nobody had stopped to ask this guy, who are you? Why did it take you an hour to get here? A few simple questions that would have helped us to know what was going on. And this is the Norman Rockwell moment, right? This is the what's up with the doll. You got to know what's up with the doll to figure out what's up with the person. So much is going on at many levels of the system, and our job is to know all of them. Now, what happens if we don't? Then we risk making the wrong decision. So the residents who failed to do the arterial puncture didn't know that the guy needed reassurance, walked away, he almost dies. They failed the patient. There are many ways in which failing to have a truly ecological view of the problem leads us to the wrong answer. And so that's why this larger model and all the ways in which it's been elaborated become urgent for us. I got out of residency and actually was in California and in San Francisco just after people passed the infamous Prop 13. And Prop 13 devastated the community mental health system. So we had just closed the mental hospitals and taken a lot of people with severe mental illness and put them back in the community with the promise that they would have supportive housing and supportive services. Prop 13 devastated all of that. So what happened next? What happened next was that people with serious mental illness became part of the homeless population. They became part of the prison population because they didn't have the services they needed to stay in place. As a psychiatrist, this was, what it said to me was, again, this lesson that what I was supposed to do in the clinic, whoever could come to see me, was nearly malpractice because I couldn't do enough to actually keep people well. And it was an issue of society that had to be understood, that had to be investigated. At that point, I decided to do AIDS research, and I was part of the Center for AIDS Prevention Studies, and looking at the issue of why was there excess risk for AIDS among blacks and Hispanics in the United States. And so this was a point at which my understanding of systems really deepened, because I met the human ecologist Roderick Wallace and learned about his work, basically a very, very fundamental paper called The Synergism of Plagues. And this is a paper that looked at the AIDS epidemic in the Bronx and traced the way in which an ill-conceived public policy called planned shrinkage had closed fire stations in the Bronx, led to a storm of fires that burned out as much as 80% of the housing in different parts of the Bronx, had displaced people from the area that was particularly affected, and this shotgunned people who were, at that point, were already infected with AIDS all over the borough of the Bronx, and created an extraordinary epidemic, influencing the whole worldwide epidemic of AIDS, because New York is an epicenter of the AIDS epidemic. In this, which is one of the important diagrams, he used this ecological method. How does an ecologist study something like this? One of the things they had to do was show where the people were, but also where did they go. And so the data that they used to show where people went was the data of student transfers. Student transfers mark the movement of families. And you can see, especially in the Bronx, although this was happening elsewhere as well, massive, massive, massive student transfers that are going on as this incredible destruction of housing. Low-income housing in a poor community of color is going on. Some of the consequences of this, in addition to the AIDS epidemic, were an increase in infant mortality, an increase in maternal mortality, a violence epidemic, and the invention of rap. And why does rap get invented? Because imagine being in a neighborhood where everything is burning down. Imagine the terror and the horror of that. And how do you speak about that? It's unspeakable what's happening. How do you speak about it? And if you think about the older R&B, you know, up on the roof, under the boardwalk, it doesn't contain the emotion. And so the young people of the Bronx invented a new musical style to express their anguish. And part of the way I know this is that when my research team was in the field interviewing people who had lived through this, they described the same things that you hear about in the rap music. So it's scientifically documented. Slightly different words, but the same things. In some of the early rap videos, you could see the kids standing around in the Bronx, and it's all burned out behind them. So this is an incredible pivot point, and an incredible pivot point for community life, for cultural life, and for epidemics. This is one simple photo of Harlem at that time. As a psychiatrist, I, too, needed to invent a new vocabulary because I had no vocabulary to describe what I was seeing and what the meaning of it was for people. What did it feel like to live in a neighborhood where this is what the buildings look like, where there were terrible smells, where there were rats gallivanting in empty lots? What was that? How did this external connect to people's internal? And so I started to work on psychology of place, which is a field that people have contributed to from many disciplines. I particularly wanted to understand the psychiatry of it. What did this kind of disinvestment and destruction, what did displacement have to do with the well-being of people? At that point, I had the real great good fortune to meet the second ecologist who's been highly influential in my work, and that's Michel Cantal-Dupart, who in this photo is the white-haired guy in the middle. This is a crew of us out on one of our projects on the Climb Trail in northern Manhattan. And Cantal said to me that if I wanted to understand the people and the neighborhoods, I was going to have to understand the whole city. And so this really forced me, basically, up the hierarchy that Engels had convinced me of so many years before. So I was at the level of neighborhood, and he said, no, a symptom in a neighborhood is a symptom of a process at the level of the city. As a psychiatrist, I can tell you at that moment, I said, what's a city? And he said, I'll teach you what a city is, but you're going to have to come to Paris because you have to learn about cities in a Latin country. This was a rough assignment. I had to go to Paris every year for 20 years. The point I want to make is that what the ecologists are trying to teach us is that health is made collectively outside the individual. Hospitals and healthcare professionals manage disease. It's society that manages health. And if we want to have a healthy society, it is not that we need a better hospital. We need a better society. So I want to go back to my pediatrician, Dr. John W. Alexander. So I was 7 when the New Day campaign unfurled, and it was really started by a campaign to desegregate the schools, and then people wanted to elect a black official, because there'd never been black political representation in Orange, New Jersey. So Dr. Alexander stood for office on a citywide basis. Now, Orange, New Jersey was 80% white, 20% black. In the politics of America in 1958, he could not be elected citywide. But the black community wanted to run him just as an expression of what it was like in 1958, right? Where right after Brown versus Board of Education. We're right after the Montgomery bus boycott. It's just at the point when civil rights is about to take off. And there was a lot of enthusiasm, a huge wish in black communities all across the nation for a turn to be made. And so my father and Dr. Alexander and all the people that worked with them wrote a platform. And so this platform is in the book, Homeboy Came to Orange, and since this platform was published when I was 7 years old, I've lived with this platform my whole life. But it wasn't until I had come to understand what a city was that I could really appreciate it. And so what I want to point out to you today is they were running citywide, so they had to have a citywide platform. So there are 7 planks in this platform: redevelopment and relocation, unemployment, the freeway, the school system, civil rights, recreation and juvenile delinquency, and representative government. This is every aspect of the life of Orange, New Jersey is touched upon by this platform. This is truly ecological thinking. This is understanding the complexity of the city and deciphering how to move it so that the city as a whole system could become a just and equitable system helping all the residents. We are still working on the New Day platform in Orange, New Jersey to this day. And some of the things about it, it says we ought to look at the redevelopment and relocation, number 2, study future water needs based on the projected plans. And Orange is still in trouble on projected water needs. It said, how about a new city hall? Orange still needs a new city hall. So some of these things when you make a big agenda, it takes a long time. Urbanism takes a long time. But part of this is about what have we been doing instead in the American city. And what we have been doing instead, and this is fundamental to understanding why we're in a crisis of gentrification, is that we have been systematically sacking the city, and in particular, destroying the neighborhoods of poor people. Urban renewal in the 1950s and 60s, federal program carried out 2,500 projects, 993 cities, and 75% of the projects were carried out and displaced people of color. Here in Los Angeles, Dodger Stadium is one of the famous urban renewal projects. All across the country you find these. Disinvestment, this is from Highbridge Park near where my research group was located, just fallen into shambles, fallen into ruins. And Hope 6, this is the destruction of Cabrini Green projects in Chicago. Repeatedly targeting low-income communities and destroying housing, destroying resources without replacement, making the communities dispersed, socially weaker, and tearing apart and destroying not only their social connections, but their cultural resources, their economic resources. So this has been happening, and it's well documented, over a 70-year period. What happens if you destroy poor communities over and over again over a 70-year period without replacing what they had? You get to what we have today. Gentrification is not a new and inexplicable phenomenon. It represents the deliberate policy creation of a housing famine that is falling especially hard on low-income people. But as the housing famine intensifies, only the very rich will be spared. This is HUD tabulations. The supply of affordable, available, and adequate rental housing stock was insufficient in 2015. And the point is that if you are at the top of the income spectrum, there's more than enough housing. And if you're at the bottom, there's nowhere near enough housing. This is a nationwide problem. Sen, the economist who won the Nobel Prize for his work, is famous for saying, no famine has ever taken place in the history of the world in a functioning democracy. Because people have to win elections and face public criticism. So we purportedly have a democracy and we have a famine. What's gone wrong? Because this is really why we have gentrification. What's gone wrong? So part of it is that is the racism, the segregation, and the ways in which that has been applied to the urban landscape. So I said there was a school fight before Dr. Alexander was launched for office, and this is the gerrymander that affected my schooling. So the line, instead of going straight down Central Avenue, jogs to take in a small part of the black community and to exclude a small part of the white community. We are now debating gerrymanders all over the United States, and you may have seen this map of Goofy kicking Donald Duck, which is a gerrymander in Pennsylvania. And look at that gerrymander. They figured out, because they can map the voting patterns everywhere a Republican lived, to create a solid Republican district that will stay Republican. This is not democracy. And this is why part of why we have a housing famine. The other fundamental thing, which must never be forgotten in this period, is the incredible concentration of wealth that's going on in our country. So in 1980, the poor and middle class used to see the largest income growth, that's the gray line. But in 2014, it's the higher incomes that are seeing the largest income growth. And this is before the tax bill gave a $1.5 trillion break to the wealthiest people in the United States. We are not in a functioning democracy at this moment. And that is why we can have a famine of housing. So I believe there are 3 lessons. The first is that health is not produced by healthcare. I think it's a misnomer. And I think people should say disease management. We are all trained in disease management. That's what we do. We don't produce healthcare. It's the society that produces health. If we truly understand the implications of ecology, and I am sure all of you do, then you know that there is no there and there is no them. It's one ecosystem. And it includes everybody and everything. There is no place to put the garbage. It's in our own backyards. And finally, you can't give back. People like to say, Ken Chenault, who's the head of American Express, I heard his wife once at a community event, and she said, I love to give back. There's no giving back if there's no there. It's only one humanity. And you are always a piece of it. And the best and most important line in this program is gentrification and health, understanding and healing the wounds of our community. It's one community, and we are part of it. If we are trashing somebody, we're trashing ourselves. And so I wanted to tell you 3 things you can do, I believe. The first is, read Howard Zinn's History of the United States, People's History of the United States. You probably read it already in college, but read it again. And secondly, join 400 Years of Inequality, which is going to observe the anniversary of Jamestown. 2019 will be the 400th anniversary since the first Africans landed in Jamestown. And one of the great products of slavery is the myth that some people are not as much people as other people. And this gets applied all across the board. It gets applied to women, it gets applied to Jews, it gets applied to immigrants. And we must attack this myth. So 400 Years of Inequality is attacking the myth of inequality. Second, post Engel's model and remind yourself to see the big picture, for which the disease is but a symptom, which many great biologists have been telling us for a long, long time. And then acknowledge your own suffering. And we like to say, oh, I'm so sorry, he's in bad shape. But if he's in bad shape, I'm in bad shape. So what's my suffering? Own your own suffering. Own that this world is hard on you. And then you will really be able to start to heal. And I'd like to end with those great words from John Donne. No man is an island entire of itself. Every man is a piece of the continent, a part of the main. If a clod be washed away by the sea, Europe is the less, as well as if a promontory were, as well as if a manor of thy friends, or of thine own were. Any man's death diminishes me, because I am involved in mankind. And therefore, never send to know for whom the bell tolls. It tolls for thee. Thank you.